Hello everyone, it's me Dr. Ayaz Ahmed. I am working as an aesthetic dermatologist. Today I will discuss another important topic of dermatology. The name of topic is clinical features of pemphigus disorder. Hopefully you will learn and subscribe my YouTube channel. Clinical features of pemphigus vulgaris. It is most common variant of pemphigus group of disorders presents with mucosal involvement in about 50 to 70% of cases. Erosion with ill-defined irregular margins on buccal or palatal area are found, which are slow to heal. Mucosa of conjunctiva, nasopharynx, esophagus, urethra, cervix may also be involved. Common sites are scalp, face, neck, upper trunk area and back area. Blisters are usually flaccid with clear fluid on normal or erythematous base. Blister rupture and produces painful erosion, which extend into edges. There is a positive Nikolsky sign. Always remember that positive Nikolsky sign is not a pathognomic. It may also be seen in other conditions. Lesion of pemphigus vulgaris heal without scarring. There is vegetative granuloma in especially plexus area are seen. Nail dystrophy, acute peroneia, subungual hematoma are observed. It may deteriorate during pregnancy and puerperum and also occur in newborn producing neonatal pemphigus. This picture describes the mucosal involvement. Always note that mucosal involvement is the first clinical presentation of pemphigus vulgaris. These mucosal involvement usually occur before cutaneous lesion. This picture describes the clinical presentation of pemphigus vulgaris, and this shows that upper trunk area, especially on the back and lower back area and upper chest area is involved. This picture describes the clinical presentation of pemphigus vulgaris. It shows that there was the big large blister which after rupture produces large eroded area. You can see there is the large erosion on the back of shoulder, on the back of elbow area here in case of pemphigus vulgaris. Clinical features of pemphigus foliaceus. It is a less severe clinical variant of pemphigus group as compared to pemphigus vulgaris. It happens suddenly with scattered scaly lesion involving seborrheic areas of scalp, face, neck, upper back area. Scales are fine colorate. Blistering is not obvious, although small flaccid blisters are seen, leaving crusted erosion behind when ruptured. Surrounded by the erythema and small vesicles sometimes are seen. Erythroderma and crusted oozing and skin rashes are also seen in some cases. This picture describes the clinical presentation of pemphigus foliaceus involving the upper chest area. You can see there are multiple small uh, vesicle and blisters on the upper chest area. This is the picture of pemphigus foliaceus, especially when there is erythroderma. In this picture you can see the skin is eroded with scales on whole of the thigh area and lower leg area. Blister after rupture produces large eroded area in lower leg. Pemphigus vegetans. It is a variant of Pemphigus vulgaris. It is characterized by the vegetation formation at flexus area. There are two clinical subtypes of Pemphigus vegetans. These include Newman's type, which is very severe form, to milder Helupa type. Antibody against desmogelin 3 and sometimes against desmocolin are seen. Vegetative lesion are hyperkeratotic, papillomatous and acanthotic. Early lesions show suprabasal acantholysis and intraepidermal vesicles in Newman type without eosinophilic involvement. Moreover, eosinophilic spongiosis or eosinophil microabscess are seen in pustular layer of Halopia type. This picture describes the Pemphigus vegetans. You can see there are multiple papillomatous lesion on plexus area with hyperkeratosis. Pemphigus erythematous. It is a localized variant of Pemphigus foliaceus described by the Sinar and Escher. Pemphigus erythematous may be associated with Myasthenia gravis and thymoma. Sunlight may aggravate it. IgA pemphigus. IgA pemphigus is of two types. Number one is the epidermal neutrophilic type and second is the subcoronal pustular type. Both these types are characterized by the deposition of IgA in epidermis and sometimes they are detected in blood. Affected persons are usually adult, associated with HIV infection, inflammatory bowel disease, rheumatoid arthritis, and thyroid drugs. Flaccid vesicle and pustules are seen on normal or erythematous base. Lesion is pruritic, having annular or succinate with central clearing evolving into crusted macule. The common sites are Gorian, axilla, face, trunk, and limb. Now differentials of pemphigus. Number first is the Pemphigus vulgaris. The differentials of Pemphigus vulgaris are acute herpetic stomatitis, erythema multiforme, ophthalmos ulcers, lichen planus, mucous membrane pemphigoid, and these are the differentials. Moreover, histological differentials are diarrhea disease, Halle-Halle disease, transient acantholytic dermatosis, which is also known as the Grover disease. These are the histological variant on the basis of differential. Pemphigus foliaceus and paraneoplastic pemphigus differential. The differentials of Pemphigus foliaceus are seborrheic dermatitis and impetigo herpetiformis dermatitis, while differentials of paraneoplastic pemphigus are Pemphigus vulgaris, erythema multiforme, graft versus host disease, lichen planus, viral infection including herpes virus. Thank you very much. Stay connected and subscribe my YouTube channel.